You've ruptured your Achilles tendon and you've been told you need a VacoPED boot. Okay, a VacoPED boot allows you to walk on high heels because as you rupture your Achilles tendon, you want to be on a high heel so the two ends of the tendon are brought back together. And when you stand on a flat foot, the two ends pull apart because you've ruptured the Achilles tendon and they're pulling apart. And you've got to get them back together. So you could walk around on a pair of high heels, which is perhaps impractical. And this VacoPED boot, designed by a company in Germany, is the one we're going to review today. It comes in a big bag, and I'm going to take it out of the bag. And inside the bag, it's got a lot of things. So it comes with a boot. It comes with a spare liner, and we'll talk about that in a minute. It comes with a spare sole. For all intents and purposes, you don't need the spare sole. And for now, you don't need the spare liner, so we'll come to those. Okay, so this is the boot. It's quite complicated, and I'll try and explain things through to you. So you undo it like a ski boot. Okay, thing to say, it's got hinges at the back. Okay, and what the hinges at the back do is they lock, okay, so that you're on high heels and you can't move, so you can weight bear on it. But if you want it to hinge, you can release them either one step at a time or all of them, and then it can move just like a normal shoe or boot. Okay, but I'm going to lock it in the locked position, and the key then sits on the back here. Okay, a spare key typically comes in the packet, and I'll show you that in a second. The front comes off, and then you've got inside the pack a pump, which is going to be used in a second, and a spare key, because you will often lose that key, and if you lose the key you can't hinge it. Okay, so the first thing to say, it's got the guts and it's got the liner. So let's go through that boot again. Okay, you can adjust the size here, okay, by going from maximum to minimum size by releasing it. Okay, you can release the button, the floor foot pedal, okay, by pushing these buttons here. So you can push one and then the other, and the full comes off. And then you can adjust the sizes here, maximum to minimum. I'm not going to do it now, but you can increase it for longer feet or shorter feet. And then we're going to put this back on and we're going to dock it. Okay? There should be 4 clicks for it to sit back on so it's nice and locked. Okay? And that's the cage in which everything's going to sit. Again, for the width, these are adjustable. These auto adjust for wider ankles or wider feet, and you can release them if you want to for wider sizes. So that's the anatomy, if you like, of the VacoPED boot. Now, why is it called VacoPED? Well, it's Vaco, meaning vacuum, ped, foot, okay? And that's because inside this container here, you've got a plastic bean bag, effectively, a big bean bag that sits inside here. Okay, and like any beanbag, if you suck the air out of a beanbag, it becomes quite firm and hard. So this is all nice and soft here, so your foot can mold to the shape inside. And if you hold it there like that and then grab this is like a dinghy, and you put this pump onto there and you suck the air. Okay, it sucks all the air out of the beanbag. Okay, we're going to suck it a little bit more, and then you can see it won't suck anymore. Okay, and once that all the air's out of it, it's now created a vacuum, and that means it's now hard. So that is now molded to the shape of your foot, and it's rock hard. Okay, and you can't get onto that because you'll get an ulcer. So what we end up doing is trying to release the air. So you can see this liner here has a green valve, and you pull it, grabbing the plastic, you pull it, and as you do it, you'll hear a hiss. Listen. Can you hear that hissing? And that just releases everything. The air goes back in and everything becomes soft. Okay? This is where your foot's going to sit inside. So what you then do is you get that out the way, everything out the way, and you ask the patient to put their leg inside. So it's going to be Cassia, who's one of our senior nurses, is going to demonstrate it, her right foot. Remember, we want the foot to be sitting on a high heel position, so the toes are facing away from the body. Okay, we don't want the foot coming up. If you do that, once you've ruptured your Achilles, you're stretching the two ends of the Achilles tendon at the back here apart. If you bring your toes up above 90 degrees, you're making everything worse and you're stretching the Achilles. So you want the Achilles to be shortened with your toes on high heels. We then put this around the foot comfortably so it sits around the foot and there. And then we're going to place it into our big container. So this is the VacoPED boot. And what we do is we try and cajole it inside. Can you get it nicely into there? Okay, and you can see that the toes are now held quite far away and it's nicely contained in there. You get the front. This is our front piece that you place on top. And this is just like a ski boot. We're going to place this now onto the top. So we're going to grab here. The most important one is this one around the ankle, because this is going to pull the ankle to the back. So the heel is all the way sitting down. Can you feel your heel at the back there? Okay, and you can then tighten this one a little bit if you want to. So that's now nicely snugly in. And then you do the same at the front and the top, just like a ski boot. And these pieces should be on the outside here. So on the outside there, the front pieces are on the outside. You can see they overlap. And you grab this one. Okay, and that is a nicely fitted VacoPED boot with the foot held in about 30 degrees on tiptoes. Okay. Now, what you can now do is stand up. Okay, that's where it locked for when I opened it before. Okay, and you can see that it's almost impossible to walk on one high heel, so you have to have something very high on the other foot in order to even up. Okay, obviously you could wear a high heel, or you could wear a normal thick trainer, or some people buy something called an even up, which the company sell, and the even up sits onto the bottom of the other trainer and then lifts you up, so it takes the strain off the hips, off the lower back. Okay, and with this you need crutches to avoid pressure on your back, and your knee must always go forward, so you land on your foot and then as you're coming forward you roll on this. Okay, and that is the VacoPED boot. I'm not going to tell you how you hinge it because your doctor's going to tell you that in the clinic, and you normally hinge it once a week or so until the treatment's ended, but your doctor will advise you how much you hinge it and when you hinge it at a later date. This stays on. If you want to get into bed, here's a nice trick. So if you sit down, Cass, and you want to get into bed, then what you do here is there's a button on either side we talked about before. Okay, all you do is you push the two buttons and it's going to eject. Okay, and that's the end of the foot. And now you've got a nice clean sole to get into bed. And this part in the morning you try and dock it, which isn't as easy as it looks, but you're basically docking it like a space station. You're trying to fit it in there and you should hear 4 clicks. So that was 1 click. Put your weight on it and you should feel the other 3 clicks. Sit down and all you do, don't balance on it, you'll fall over. So try putting your foot onto there. It's not the easiest thing. You'll get used to this. You've got to try and dock it. Yeah, that's 1. That's only 1. 2. I think you got the 4 there. We're now back docked in. Okay, so there's a nice little trick that you can do. If you want to, and you, I told you before there's a spare one. If it's dirty, this thing gets all horrible because you're going to be in it for several weeks, then you can take this off and you can replace it with a nice one that this can go in a washing machine. The problem is the guts inside doesn't, you don't get 2 guts. So you have to take the guts out. So you have to unzip it, take the guts out, which is a bit of a palaver, and then you've got to feed it into the new one across all 4 channels like that, and then close the zip, and then you've got a nice new clean one while the other one goes in the washing machine for next time use. You're going to be in this for potentially up to 12 weeks, so it's really important that you get used to using it.